Good morning, everyone. I'm just about to start a facelift surgery and thought that it was a good time to discuss what potential complications may arise from such surgery. I do quite a bit of facial rejuvenation surgery in my practice, and occasionally 1% of the time, 2% of the time, there are issues that I deal with because it's just part of the process. So complications are some things that nobody wants to talk about and nobody really wants to hear about, but it's the reality. I trained at the Cleveland Clinic in Ohio and work with some of the best surgeons in the world. And no matter how many surgeries you do, how much experience you have, complications at times are inevitable because a lot of variables are hard to manage sometimes. However, the important thing to keep in mind is that you don't fear complications, but you learn how to manage them, not only to restore the normalcy for the patient, but also manage the hand holding that's going to be required to emotionally take care of them, because surgery and going through any type of healthcare issue is very emotional, very taxing, and scary for everybody. I would probably feel the same way. And so the important thing to convey to everybody, especially patients who are going through surgery, is to make sure that they're confident that the surgeon is going to be with them. The surgeon is competent, the staff is competent to manage any potential complications that may arise, and not to abandon the patient, and make sure that all of the necessary things are taken care of during the process of the postoperative care. Nowadays, with so much marketing, right? Everybody just says everything is great. Look at the before and after. There's TikTok videos, there's Instagram videos that all you see are glamorous before and after pictures. But there's a journey between those two pictures, So there's a time period. There's some healing. There's some swelling. There's some bruising. There's some things that the patients have to endure to get to that after picture, which often looks great. And during that time, there may be some people, like I said, 1% of the time, maybe 2% of the time, suffer some minor issues, occasionally moderate issues, and extraordinarily rarely maybe major issues. And it's important, as an honest surgeon, honest discussion, we discuss it with patients, and everybody should know about them before deciding on any type of surgery. Since I'm doing a facelift surgery this morning, I'm going to talk about the specific complications that may arise from facelift surgery. Okay, I'm going to break it up into two components. One component, complications. Okay. And this is for facelift surgery. I'm going to basically break this up into two main issues. One is anesthesia, and one is just surgical. Okay. I've kind of done this before, a little bit about anesthesia. The complications with anesthesia are pretty standard for any type of operation. These include, just difficulty with nausea postoperatively. So one thing is nausea. I would not really call that a complication. I call that an expected thing that some people experience, but we manage it with the medications, right? We manage it with medications, and 99% of the time we can manage it very well, where very few people have any nausea at all, and even if they do, it's mild. The second one is, some issues with waking up, and it could be slow. So patients sometimes wake up slowly, meaning the drugs are too effective, or maybe the patients are too sensitive, and therefore the usual wake up period can last 2, 3, 4 hours at times. And that, again, I would not classify it as a complication. I would classify it as a normal thing for a few people, not everybody. But people have to know about it, because the implications of that are timing, to stay at the facility, timing to go home. Sometimes if you have these things, you may have to be admitted overnight, or for a longer period of time, because you're not ready to go home if you're not fully awake. or if you're suffering from nausea, because we may have to give you medication sometimes in an IV format versus a pill, because they're throwing up, you can't really swallow anything. So these may delay the discharge time course. The third one is urinary retention. So often, when medications are given during anesthesia, the medications can slow down the whole systems of the body. The brain, we manage the heart rate, we manage the blood pressure, and sometimes we give narcotics, which are pain medications, during surgery, and that medication can sometimes weaken the function of the bladder, and hence when patients wake up, their bladder is not fully functional. They're constantly processing all of their body fluids and producing urine, and the urine is within the kidneys and the urinary system, but they're not able to get rid of it because the bladder, which is necessary to function, is not adequately pumping the urine out, and so they retain a lot of urine, and that can cause distension of the lower abdomen. Obviously that can cause general discomfort and cause rise in blood pressure, just general issues with well-being. And so if that happens, we may have to put a catheter in. Sometimes we may have to just delay the discharge again, and occasionally patients who are older may need overnight a catheter placement, and maybe sometimes go home with it. But I don't want you guys to think that this is common. These issues are rare, and many times complications are, at least in my practice, 1 to 2% of the time that we deal with stuff like this. So it's rare. And as you can see, these are pretty mild issues. Nausea, waking up slowly, and urinary retention are mild issues. These are not life-threatening. These are not long-term consequential things. These are just temporary things that we have to manage during surgery. And again, this is again not a complication, but anxiety and fear, right, of surgery in general, or anesthesia in general. I would again not classify this as a complication. It's just a normal human emotion that people deal with. No matter how experienced or how many operations or how often they've been to a hospital, anytime you feel like you have to go under surgery, everybody gets nervous, and I've had surgery on my own myself, and I felt the same way. It's just a normal human reaction, and so we manage this as well with some medications and such. Okay, and anytime you have anxiety and fear, it can aggravate all the other systems in the body as well. So it's important for us to be very much on top of this, because anxiety can heighten the pain. Anxiety itself can cause nausea. Anxiety and fear can cause changes in your blood pressure. So there's a lot of systems that it affects. So it's very, very important to have a very calm state of mind whenever you're at the hospital, whenever you're in surgery, whether you're a patient or the surgeon, because mind manages all, right? So you have to be in an extremely calm disposition always, and we try to convey that with the atmosphere that we work in, and also with in patients' case, some medications as well. There's other complications of anesthesia that I'm not going to cover, because at least in my case for facelift surgery, I do all of these cases under IV anesthesia. We don't put people on machines. We don't put breathing tubes down. We don't give any paralytic medications. We don't put them on any gas to get them really deep sedated. We don't paralyze them. We don't do any of those things. So all the consequential complications that may arise from anesthesia, when it's deeper anesthesia, which we do not do for facelift surgery, that's a whole different topic and a whole different discussion, and I'm not going to cover that because we don't do that for facelift surgery. I will do a more detailed video about complications of bigger surgical stuff, but this is, since it's specifically about facelift surgery, let's stick to that. And the issues that you can get with IV anesthesia are pretty minimal, and these are at the top of the list to be aware of. Okay, so these are anesthesia things that patients need to know, but please know that we manage them very, very well, and the incidence of these things is very low, 1, 2%, 3% maybe at the most. Okay, So let's go on to the surgical stuff. This is a bit more important. I've noticed, I've been in practice for 16 years now, and when I started practice 16 years ago to today, the world is entirely different. I mean, I don't even recognize the world that we live in, especially in healthcare, because you can see me, I'm in front of a camera doing videos, which I never did before when I started my career, because this is where the world is going. So, and so the surgical complications are never spoken about because it's all about glamour these days. It's all about instant gratification. It's all about, look at the great before and after picture. Look at how everybody's smiling and having a great time at the beach or at a party or something. But it's important to, get real and honest, and know that surgery is serious business, and surgery is very good. And surgery can do a lot of good very safely for overwhelming majority of the people, 99% of the time. But again, about a 1 to 2% of the time, some patients experience some complications that you have to manage. The number one complication in surgery that we always talk about is bleeding. Okay, so in facelift surgery, essentially we are operating the entire face, the entire neck. It's a big area on both sides, and anytime you operate in a big area, there's thousands and thousands of blood vessels everywhere that we manage, and we know how to manage it. Obviously, that's why we do the surgery. However, there's a small chance that after the surgery is done, people can get bleeding underneath the tissues that been operated on. And when the bleeding occurs, it's usually very small and it's not a big deal. And the skin looks a little bit bruised and easy to manage, not a big deal at all. Occasionally, usually happens maybe couple hours or maybe half a day to day later, some patients can get a big swelling underneath the skin in the neck or in the face. Since it's very shallow and superficial and it's very visible, it's very easily manageable because it's not like it's inside the abdomen where you cannot see and you're just describing general pain or something. But in the facelift surgery, since it's right there in front of you, anybody from a mile away can see that there's swelling, and we also very closely follow the patients. And if you see that, you have to bring the patient back and manage that issue. Essentially, it requires a little bit of opening of the incision, draining the stuff out, and putting some stitches back in, and that most of the time takes care of the problem. Many times patients don't even need to go to sleep again to manage it. It's just done in the office when patients are awake, and it does very, very well and very easy to manage, and you have to put some compression dressings to manage it postoperatively. So bleeding is one issue. I don't want to minimize it, but again, the incidence of this is, in my practice, maybe I have one of this every other year or something like that. But now, as I'm using technology, we use a lot of mobile technology to manage patients. So we're always in touch with them. They have an app that they use called the Symplast App, and they're able to do live video chats, live imaging, live texting in real time to reach me or to reach my office staff, to always be aware of what's going on. So they never feel like they have to rush to the emergency room or it's 2 o'clock in the morning and they can't get a hold of somebody and they don't know what to do, because this technology has made it very, very seamless to engage with patients to make sure that we are aware of what's going on and they know that they have the support that they need if anything like this happens. Okay, bleeding is one thing. A lot of people worry about infections. Especially nowadays with COVID and all such things, although COVID virus, a virus is not a bacteria, typically infections in surgery are caused by bacteria, which is very different than virus, okay? And a lot of people inherently feel like they need antibiotics because surgery has been done. That is not the case, okay? In 16 years of my practice, I've never ever had to give anybody antibiotics after surgery. The typical standard protocol for any surgery these days is that we give 1 dose of IV antibiotics in surgery about 30-40 minutes before surgery, and that's all the patient really needs, especially for facelift surgery. The face is a very robust vascular area of the body. It gets tremendous amount of blood supply. It's very, very close to the heart. Obviously, the blood needs to get to the brain, and so that is a priority for the body, that there's a lot of activity in terms of blood supply to the face and tissues of the face, and so the healing of the face is extremely fast, very robust, and very, very resilient, even in older patients, even in diabetic patients, even in people who have vascular disease of the body. They heal quite well in the face. And when a human system is working well, It's perfectly capable of taking care of any minor things that happen, like healing or wounds or something like that. People do not need antibiotics for this, and you rarely, if ever, see infections with facelift surgery. Rarely ever. You may have a localized issue here and there. I take it back actually. I just recall there was one patient who had a little bit of a issue with redness in the side of the face that had to be treated with antibiotics. So I'm just, as I'm talking, I'm thinking about it. It's rare. That's why I didn't even recall it. But there was a patient that I had to treat with the oral antibiotics only about 3-4 weeks after surgery. Just in front of the ear, there was some redness, but it's very minor. It resolves very easily. So I take it back that there was never, but there was one that I recall. Anyway, so the infections are extraordinarily rare, not a problem with facelift surgery at all. The third one is skin or incision issues. These can be broken down into scar issues or wounds, okay? And so let me talk about the wounds first. In facelift surgery, the idea is you are taking all of your loose skin and you're trying to tighten it up so that you don't have any, turkey gobbler necks, you don't have any jowls, you don't have any, kind of droopy looking tissues, and you're trying to stretch them back to where they were when people were young, right? And when you pull something tight, the tension of that tightness can cause constriction of blood flow to that tightest area. Typically, the tightest area obviously is where the incision is, because that's kind of where you're pulling it. And so the incision area, which is usually in the back of the ear, a little bit in front of the ear, is where the tightest part is. And there's several techniques we use to minimize tension on the skin, but at times blood supply could be compromised. And if that happens, you have issues of wound healing around the areas where the incisions are. Typically, most commonly, it's behind the ear in this area where sometimes people get wound healing issues. Occasionally, very rarely, people get a little bit of issue in front of the ear as well, but most often people get wound healing issues in the back of the ear. It's also rare in good facelift surgery, but it can happen. But it can also be very well managed if that does happen. It is not something that is going to create any long-term issues for patients. These patients may require a little bit more work with scar revision, maybe some laser resurfacing, maybe some other things to manage the area post-surgically, but it's a short-term bump in the road. It may delay their healing because they can't get back to full activity, which is usually about 6 weeks. It may prolong it to 3 months maybe, but almost always all of these wound healing issues can be managed well. So this should again be put in the context of the incidence or the frequency of these. Again, these are rare, less than 1% maybe, or less than 0.1% of the time do people get any major issues. People do get minor issues where some of the skin breaks down, but it's very, very small, very minor. Most typically, you don't have to do anything about it at all. It just heals on its own with some time, with some minor wound care. And so that is one issue that people should know about. So when we talk to patients, we tell them that our expectation is that you should be able to go in public and be presentable in about 2 to 3 weeks. And even if you have a wound problem in the back of the head or back of the ear, most of the time, patients can cover up themselves with some hair in front of it and they can go about their day. And, they are careful at how they move their head so that it doesn't show. But typically, I recommend and encourage patients to go about their life and, act as if they are healed, because this can be cosmetically covered up with just hair coming down or maybe some clothing worn a specific way that manages it temporarily as it's healing. And when they need some additional work done, we schedule it as needed and manage it however it needs to be, and get them to fully heal. And sometimes if patients need skin care, we also do that over time, maybe 6 months, 8 months, 1 year sometimes, to get it to look as good as we possibly can. Okay, so that's the wounds. Scars Of course, people worry that their scars may show, it's on their face, it'll be visible, and they can get worried about it and self-conscious about it. But I mean, the reason we do so many facelifts is because the scars generally heal well, extremely well. And they're inconspicuous. They are hidden in creases in the ear, in behind the ear, so it's hardly visible at all. Occasionally, people do get a little bit of thickness of scars in the back of the head here, behind the ear, and if they do get that, you have to do scar revision there. Sometimes scar revision could mean that you remove the scar and cut it out and restitch it up. Sometimes it may just mean a little bit of injection of steroid. Sometimes it may mean laser resurfacing. Sometimes it may mean a few other things. But a very simple problem to deal with and manage, and it's not something that I worry about or patients should worry about, because it's very, very easily manageable if patients do get an issue. If people get issues with scar in front of the ear, also you could do a scar revision very similarly, just like in the back of the head. But rarely you have to do something in front of the ear. And if you do, we usually take care of it, about a month, 2-3 months after surgery. Okay, so I think if you generally know these things, you will be much more prepared for surgery. And an office like mine is always vigilant and watching over these things to make sure that we guide the patients properly. So the more informed you are, the better you're going to do. The more information we provide you, the better you're going to do. The more in communication you are, the better you're going to do. So this is yet another attempt by our practice to make sure that the patients that we manage have access to knowing all of these things. So just to review and summarize: complications, facelift surgery, anesthesia issues, surgical issues, separated them, gave you very high level information for both, and these are very easily taken care of because we only do IV anesthesia. These are relatively simple issues to take care of as well, even if they're surgical issues. Okay, if you guys have anything to discuss or ask questions, please post it. I'll be happy to answer them, and I'm going to do additional content for you guys to learn more about this type of surgery. Thank you.